Good afternoon. Welcome everybody, and thanks again for being here today. I will try to keep you awake this afternoon after lunch. This is not going to be an extra long presentation, but hopefully it's something that you as hospice providers are excited about. I know that CMS is excited about this as we move forward to launching the hospice compare site later this year. So I'm going to talk a little bit about hospice public reporting, what we can expect, what it's going to consist of initially, and how we will sort of notify you of additions to this in the future, and then what already sort of exists out there at this time. Again, my name is Charles Padgett. I'm a registered nurse by trade, and I have previously led the IRF and LTAC public reporting effort at CMS and stood up those compare sites, which we just released in December, and I'm now helping with the hospice compare site and helping to get that up and going. So the objectives for today, we're going to discuss the requirements for establishing the procedures for making hospice quality data available to the public. We're going to describe the quality measures that will be subject to public reporting. And we're going to identify how to locate data on the Centers for Medicare and Medicaid Services compare website, and also at the data.medicare.gov website, which will eventually house sort of the underlying data behind the publicly reported performance data. The Affordable Care Act initially established the Hospice Quality Reporting Program and mandated that the Secretary and by proxy CMS should establish procedures for making that hospice data available to the public, and it also mandated that we establish a process and put a process in place so that hospices can review their data prior to its public release, so that there are no surprises, so that you're aware of what your performance scores are as we see them. Hopefully as we go along throughout the year, we're not going to talk about reports today, but you will be we will have other trainings on reports and reports you can use to sort of understand where you stand at any given time with respect to your performance. But we will, at the very least, provide you with reports that do allow you to review any data that we're going to make public prior to us making that data public. The Affordable Care Act further requires that the Secretary, and again by proxy CMS, shall report quality measures that actually relate to hospice care provided by hospice programs and on a CMS website, very similar to Hospital Compare, and the two newest websites, or compare websites, the IRF and LTAC websites, compare websites that just launched in December of 2016. Public reporting of quality data is a really vital component of a robust quality reporting program. When consumers increase their knowledge of healthcare performance, they can make better informed choices for themselves and their loved ones. Public reporting can also cause low-performing providers to make more meaningful choices or changes in order to improve their performance. And again, healthcare workers, with increased knowledge of their own performance, that can help foster changes and help motivate them to give better care. CMS is fully committed to developing the necessary systems for transparency or transparent public reporting of hospice quality data. What do we mean by that? We want to make sure that not only is the data made public, the performance data made public, but also that the underlying data, all of the item set data and the CAP survey data is available as well, for research and for public use. And also, beyond that, all of the methodology that we use in order to calculate your performance on these quality metrics, that information is available to the public and to yourselves so that you can better understand exactly how it is that we get to the numbers that we get to. It's essential that the data be made available to the public and that it's meaningful. And what do we mean by meaningful? In order to be meaningful, it has to be easily understood. When we get into quality metrics, sometimes it can be complex, and a percentage doesn't always mean a lot to a consumer. So beyond just listing a percentage on the compare websites, we also have other ways of interpreting the data, not only graphically or visually, but for some measures we use evaluative statements, such as better than the national average or worse than the national average, that help consumers to understand where it is any particular hospice lies with respect to other hospices around the country and with respect to the national average or the national mean. Comparing performance between hospices, as many of my colleagues have said earlier, requires that measures be constructed from data that's collected in a standardized and uniform manner, that we all have sort of the same definitions and understandings of the data that we're collecting. And for this, we used the hospice item set that Franzi did go over earlier, and some of my other colleagues. And that allows us to ensure that all of the data that's collected from you is comparable. There's 7 currently available hospice item set based quality measures that we feel will provide consumers with useful information and will be reported on a CMS Compare website. The 2 new measures, the 2 newly finalized measures in the fiscal year 17 rule, which is the hospice visits when death is imminent pair, and then also the hospice and palliative care composite process measure that Franzi reviewed earlier. Those 2 will not be publicly reported initially on the Compare website. These following 7 measures will be, however, the patient treated with an opioid who are given a bowel regimen. That is going to be reported as a percentage of patient stays with vulnerable adults treated with an opioid that are offered or prescribed a bowel regimen, or that there's documentation as to why this was not needed. Pain screening will be reported as percentage of hospice patients stays during which the patient screened positive for pain and received a comprehensive assessment of pain within 1 day of screening. The pain assessment measure, which will be reported as percentage of hospice patient stays during which, I think I just reversed those 2. So pain screening was a percentage of hospice stays during which the patient was screened for pain during the initial nursing assessment, and the pain assessment was a percentage of hospice patients during which the patient screened positive for pain and received comprehensive assessment of pain within 1 day. Then going down the list, dyspnea treatment, dyspnea screening, treatment preferences, which again refers to whether or not the hospice discussed preferences for life-sustaining treatments with patients or documented the reason why they did not. And lastly, here, beliefs and values addressed, which refers to whether or not a discussion of spiritual and or existential concerns was documented for a patient stay. And all 7 of these will be displayed on the Compare website when it launches later this summer. Once the data goes up, it will display, where we will be displaying individual scores for each of the 7 quality measure scores and they will be displayed for each hospice as well as a national mean. Hospices with a quality measure denominator size of fewer than 20 patient stays, which is based on 12 rolling months of data, will not have the quality measure score publicly displayed because it may not be reliable based on the small denominator size. CMS will continue to monitor quality measure performance and reportability, and would adjust any public reporting methodology in the future if needed. We're always monitoring our programs. Any concerns you have, we always ask that you send them in via our help desk. I just want to let you know we are paying attention. We want to know if you're ever feeling that a quality measure is having unintended consequences or unintended effects. Very important to us. Now I'm going to go over a few important definitions, and the definitions here are relevant insofar as they apply to sort of how records are selected and how the metrics or how record selection takes place for the quality metrics that will be displayed on our Compare websites. There is more of this that is available to you. This is very abbreviated, I will say, but there are manuals that are published on the Hospice Quality Reporting website. Specifications for the hospice item set quality measures talk a lot about these same sort of definitions and record selection. Target period, which is the span of time that defines a quality measure reporting period, such as a calendar year quarter. The target date for a record is defined as follows. For an admission record, when you choose under A0250 the reason for an assessment as 1, the target date is equal to the admission date, which is A0220. That's the admission target date. And on a discharge record, when you choose 09 as the reason for assessment, the target date is equal to the discharge date, which is A0270, and that's the discharge target date. The data selection period, which is the span of time that determines which data are used to calculate the quality measure for a target period. Each target period is associated with data selection period, and for example, a calendar year with the data updated quarterly. Records with the target date within the data selection period are assigned to a target period for reporting. And lastly, the data selection period is not necessarily the same as the target period. And for example, a target period can be a calendar year quarter, while the data selection period can be a year. The CMS Hospice Compare website, which will provide valuable information regarding the quality of care provided by Medicare certified hospice agencies throughout the nation, as I said earlier, is expected to be launched in late summer of 2017 of this year. And consumers will not only be able to look at performance data, but they'll be able to use the website to search for hospice providers by zip code, by name. They'll also be able to find other provider and quality information. There's tips on how to use the website and how to search for a hospice that's appropriate for your situation or circumstance. And there's a hospice demographic data that's available to consumers on the website as well. And like other Compare websites, the Hospice Compare website will in time feature a quality rating system that gives each hospice a rating of between 1 and 5 stars. I don't know if you're familiar with Nursing Home Compare or Hospital Compare. These Compare sites have gone to star ratings. The goal of the star rating system is really to provide patients and their families with an easy way to understand the assessment of quality and make meaningful distinctions, between high and low performing hospitals or hospices in this instance. I will say that before we ever do this, we would announce to you our plans to do this through a proposed regulation. We would use notice and comment rulemaking so that we can understand the community's any concerns and thoughts that you have or ways you think we could improve this sort of rating methodology. Excuse me. Okay, now we're going to advance. This is a little quiz slide that asks how many HIS-based quality measures will initially be subject to public reporting in 2017. You can use your little responders on your table, A2, B5, C7, and D9. I'm not going to give you a full 30 seconds for this one. Okay, looks like everybody answered C, a few people A. 7 is the correct answer, C. All right, second little quiz. Please choose the answer that correctly completes the sentence. The implementation of a hospice star rating system will A, occur in spring or summer of 2017, B, be announced at a later date, or C, occur in fiscal year 2018. I'll give you a few seconds. All right. Good job. Looks like everybody got the right answer. Be announced at a later date. All right. Compare websites are available you can navigate to them through going to Medicare.gov. That's sort of a launching page for many different things, including the Compare websites. Once you get to the Medicare.gov page, you would just navigate to the Quality Planning and Compare Tools button, which is toward the bottom left-hand side of the page. The Compare websites will also be linked from data.medicare.gov. And as is the functionality now, once you're on any Compare site, you'll be able to direct link from that website to any other CMS Compare website. And this is a little screenshot of the Medicare.gov website I just spoke about, and there highlighted in red is the Quality Planning and Compare Tools button that you can choose, which will help you navigate to the Compare websites. The sites assist consumers in finding and comparing doctors, hospitals, and other providers. They're useful to find about services the providers offer. Beyond listing just your hospice or just a hospital, these sites also list specialties that particular providers provide. They allow consumers to make side-by-side comparisons on the care provided for one or more hospices or hospitals. They will allow actually up to a comparison of up to 3 providers at once. And again, as I said before, there will also be helpful tips that are available to the consumer and to yourself on choosing a particular type of provider and health plans and so forth. Currently available, Hospital Compare, which includes the post-acute care institutions, inpatient rehab facilities, and long-term care hospitals, or LTACs, which was just launched in December. Nursing Home Compare, Home Health Compare, Dialysis Compare, and a doctor and other health professionals Compare site. As I said, it should be arriving late summer 2017. The site provides direct access to the official data from CMS that were used on Medicare.gov Compare websites and directories. So as I said, all of the underlying data will be published and will be available to consumers, researchers, and the community, the hospice community. And the goal of the site is to make all of this data readily available in an open, accessible format. I believe that the sort of underlying data is offered in a CSV format. Currently available offerings on data.medicare.gov. We list all of the hospice agencies that have been certified by Medicare, and on that list it includes the addresses, phone numbers, the dates of original CMS certification, as well as additional demographic data, proprietary versus nonprofit, freestanding versus those hospices that contract with hospitals for their inpatient needs, as well as a listing of hospice and Casper and Aspen contacts. There's email and phone contacts for those folks, and you can also view a map of the regional offices, the CMS regional offices, within the data.medicare.gov. I just went over that. Lastly, on this slide, lists sort of the web address or the direct link. And lastly here, we're going to do a little demonstration, and I'll ask you to be patient here as I'm working together with another person who's going to be navigating for me. But we just wanted to give you a taste of what's to come. The Hospice Compare website is going to be based on a very similar design that we used for the IRF and LTEC Compare websites. This is the Medicare.gov website from which we stated you could navigate to the Compare websites. And if you look down on the left-hand side, there's the Quality and Compare Tools button, which brings you to this page. And then you'll see in the middle it says, I want to find, and you will eventually see hospices there, but I'll ask that you go to long-term care hospitals. And this is sort of the welcome page for the Compare website. The hospice page will look very similar. It allows you to search for hospice, not only by name, but by zip code, city, or state. And I'll ask that you just type in 21043, which is very close to here, Ellicott City. And you'll see that a listing of all the hospices within a 250-mile range, or not all the hospices, I'm sorry, all the LTECs within a 250-mile range come up on the left-hand side of the screen, while a map showing those same LTECs comes up on the right-hand side of the screen. And so I'll ask that you just select one of them. And so if you select one of them, you can go and look at all of the quality metrics that are reported for this LTEC. You see on the left-hand side of the screen, rate of pressure ulcers that are new or worsened. It shows the name of the hospital, their score, which is a 1.2%. It shows the national average next to that, which is 1.8%. As I stated, I'll just ask that you go over the show more link. Yeah, there you go. And this will be available for all the hospice measures as well. It just talks a little bit more about the particular measure that you're looking at. This, for instance, and it explains here that a lower percentage is better for this particular measure. Also, there is a graphic view that's available. And you see here the Bridgeport Hospital, Hadley, with the 1.2%, and then next to that it shows the national mean, or the national average for that hospital. So I'll ask if you can just navigate back a page to the listing again. And so you see the green button that's listed under each hospital. That's how you would add each hospital to be able to compare them side by side. And I'll ask that you just add two more. And then you can go up. It shows the three that you've chosen. You can hit compare. And then you're looking at these LTECs side by side. Folks will be able to do the same for hospice. You can also, at this point, just look at them individually if you want, but as you scroll down, it will show you their performance on each of the quality metrics side by side. And for instance, if something says not available, as you see here under catheter-associated urinary tract infections for Bridgeport Hospital, Capitol Hill, next to not available is a little footnote. And if you just scroll over that, a reason will pop up, or a definition of that footnote, which says data suppressed by CMS for 1 or more quarters. And for instance, this one says data suppressed, also results cannot be calculated for the reporting period. Within the materials, there are further explanations about those footnotes, but those are available for any sort of rating that may not make sense at first glance. But it allows you to look at these side by side. Also, if you go to the graph view, please, it allows you to look at them in a graphic form and compare them against the national average as well as against one another. All right, you can, if you'd go to data.medicare.gov now. This is a page within that. Great. Thank you very much. So if you go to data.medicare.gov, this is sort of the welcome page that you'll first see. If you scroll down on this page, you see it says explore and download data, and then you'll see each of the settings for which this data is available. And we actually see a hospice directory data that's available there, so we're going to click on that. And you'll see hospice data directory data sets. If you scroll down from there, it'll show you the 4 sort of categories under which data is presently available. Hospice agencies, that's where you can go ahead and click on that quickly for me. That lists all of the hospice agencies that are certified by Medicare, lists their address, their phone number, their CCN number, and their date of certification for any of them. You can scroll back. Thank you. And then I'll just quickly, I don't need to go to each of these, but the CASP and ASPEN context I spoke of earlier is there. And then you'll see the CAPS survey data and finally the HIS data. As of right now, only the national means are available under those 2 categories for the CAPS survey and for the HIS derived quality metrics. But as of late summer, this is exactly where you'll be able to get the underlying data for all of the quality metrics for each of the hospices for research or for, there are many facilities that like to sort of calculate metrics on their own to see if they're coming up with the same score that we are, and the data is available here for you to do just that. All right, that's actually all I have today. I'm going to wrap things up. I see we're running out of time here, but I'll take a few questions. Could I ask that you go to the microphone just so it can be captured for, thank you, I appreciate it.
So just to confirm, for the summer of 17 release, it's going to be both hospice item set and CAPS data showing on the hospice compare.
At this moment, yes. If that changes, we would notify you prior to the launch of Hospice Compare.
Okay. And is the CAPS data going to show as mode adjusted, or? I'm sorry? Is the CAPS data going to show as mode adjusted based on whether it's mail or phone? Do we know yet?
I believe so.
Okay.
But I will ask that if you just submit that.
Okay.
And we'll get you a definite answer to that. Anybody else? All right, thank you very much. I appreciate your time and your attention.